నెక్కే కదా మరి ఏది దీంట్లో ఎక్కడ ఉంది ప్రోస్టేట్ చూపించరా రోజు వేసుకోవాలి రోజు వేసుకుంటే మంచిగా నువ్వు పట్టుకో దీంట్లో వేర్ ఈస్ ద ప్రోస్టేట్ గ్లాండ్ ఫస్ట్ ఐడెంటిఫై ఈజ్ ద ప్రోస్టేట్ గ్లాండ్ కాదా ఈజ్ ద ప్రోస్టేట్ గ్లాండ్ నో చూడు మరి ఎక్కడ ఉంది ప్రోస్టేట్ గ్లాండ్ వేర్ ఈస్ ద ప్రోస్టేట్ గ్లాండ్ చూడండి ఫాస్ట్ వెరీ గుడ్ యూరేథ్రల్ ఓపెనింగ్ you lost your chance. Please search for the prostate gland. Where is the prostate gland? Very good. He came to the point. So now the prostate should be over the neck of the urinary bladder. Ante adi kindiki undali kada. Just keep it down. It is facing what? Anteriorly. Down. Right. Okay. Vachesindi kada. Now if I because in order to avoid this confusion, I am cutting this lateral false ligament. I only want to keep this medial umbilical ligament. Right. Now with the Chushunda, he has holded it in anterior position. Once he has holded it in anterior position, now you can see, like the anterior position. Now you can see, right, here are the ureters, right, and other structures, right. Adiko. Confusinda. Now see. Prostate, apex, and the ureters, right? Now you understood? So whenever you get the urinary bladder, first of all you have to keep the prostate down, then look for the median umbilical ligament, right? And then look for the ureters, right? This is also extra piece only, you can cut this. These are all the false ligaments, okay? Even the cut chesukochu. Now these are the ureters I told you, right? Question for you, Teja Swini, very good girl. This is the ureter, right? Please tell me why there are two structures there. Can you identify those two? One and two. What are those? Right and left. Right and left. Seminal vesicle. Very good. Yesterday's diagram, do you remember? Urinary bladder I have drawn. Just behind it I have kept the ductus deferens. Then the seminal vesicle I have drawn. Simple. So in the practical examinations, if you see the two tubes, don't get scared of. They are nothing but one is a vas deferens, one is a ureter. Now pull this like this. It is going inside properly, right? Inside the urinary bladder. So this is the ureter. The next one will be the vas deferens, right? And this part, whatever is there, this is nothing but the seminal vesicle, right? Okay, now I am just starting with the urinary bladder. I am holding it in anatomical position. See, whenever I said the urinary bladder, already I told you people to remember Jack and Rose, right? Titanic. You Titanic ship vachinda, right? So this urinary bladder, now coming to, it's a muscular organ belonging to the urinary system, right? And this urinary bladder lies in the anterior part of the lesser pelvis. And now coming to the urinary bladder, the neck of the urinary bladder lies approximately 3 to 4 centimeter posterior to the pubic symphysis. The neck of the urinary bladder lies approximately 3 to 4 centimeters behind the posterior to the pubic symphysis, right? And this urinary bladder has got now some shape. So always remember the shape, position, and also like what? Shape, position, and location. All these three, the shape, position, and location of the urinary bladder changes according to the volume of urine present in it. So an empty urinary bladder, appears to be tetrahedral in shape, while a distended urinary bladder appears to be what? Ovoid in shape. And this urinary bladder is abdominopelvic in infants, while it is pelvic in adults, right? And this average capacity of the urinary bladder is 120 to 320 ml. The mean capacity is 220 ml, and the anatomical capacity is between 1 liter to 200 ml. Already told you in the class. And which means that once the urine collects up to a volume of 220 ml, then the person will get a sense to urinate. Whenever our bladder gets filled with approximately 220 ml of urine, we will have a sense to urinate. Once the volume of urine increases to 250 to 300 ml, then we will feel that yes, I have to go for urine. I have to urinate now. I have to micturate now. Which means that between 250 to 300 ml, the person will empty the bladder. If you still hold, if the volume of urine crosses 500 ml, then the person will start having pain in the lower abdomen. So it causes pain. Okay, and now if it crosses 800 to 1000 ml, then it will rupture the urinary bladder. Right, now coming to the empty urinary bladder, it is tetrahedral shape, and now you can see it is having 4 surfaces, 2 inferolateral surfaces, right, and also chaibetikara, 1 superior surface, 1 base. So it has got 4 surfaces, 2 inferolateral surfaces, superior surface, and a base. Right, now coming to the borders, it is having an anterior border which separates the 2 inferolateral surfaces, right, and now it is having 2 lateral borders which separates the inferolateral surface from the superior surface, and a posterior border which separates the superior surface from the base. Right, now coming to the base of the urinary bladder. In the base of the urinary bladder, we have seen the opening of the ureter, the ductus deferens, and also the seminal vesicle. Now if you see, these are the 2 seminal vesicles which are like this, right? And these 2 seminal vesicles along with their ductus deferens are separated from the rectum here by a fascia, which is nothing but called as the fascia of Denonvilliers. Yesterday I have drawn it.
Yes.
This is nothing but the fascia of Denonvilliers, which separates the base, the seminal vesicles, and the ductus deferens from the rectum. Clear? This is about the base. Now coming to the inferolateral surfaces. These inferolateral surfaces, if you have listened to my class properly, definitely you can answer it very easily. The 2 inferolateral surfaces are related to the posterior surface of the pubic symphysis, retropubic fat, the space of Ritzius, and it is a female. So in case of female, it is pubocervical ligaments. If it is male, it will be the puboprostatic ligaments. These are the relations of the inferolateral surface. Now coming to the superior surface. The superior surface is related to the loop of small intestine in case of males, while in case of females, as there is an uterus which is anteverted like this. So the superior surface is related to the uterus, upper part of the cervix, and also the loop of small intestine. So these are all the relations of the surfaces of the urinary bladder, right? So now this is all about it. Rest, relations, whatever you say, I have already taught you. You can understand that this is the apex of the urinary bladder, which is showing a nice ligament called as the median umbilical ligament, which is an embryonic remnant of Buracus.